I'm Andrew Foster, a clinical professor at Duke Law School, and I'm so pleased to be joined today by Tara Kenshin to talk about some of the challenges and opportunities that we face in the work of building a more just and equitable society. Tara is a teacher, a lawyer, a nonprofit executive, and a community leader. For more than 25 years, she has been deeply involved in efforts to transform communities and uplift people. Currently, she's leading her own consulting practice, UF Strategies. Previously, for several years, she was the president and CEO of the North Carolina Community Development Initiative and its affiliated community development financial institution, the North Carolina Community Development Initiative Capital. Through that work, Tara helped to finance the development or preservation of more than 7,000 units of affordable housing across the state and leverage more than $420 million of new private capital investment in low-income communities for community development projects. Tara, thanks so much for making the time to be with me. Maybe we'll just start with the obvious question, which is you spent most of your professional career working in the field of community economic development. What is CED and what's that work trying to accomplish?
So, I laughed just a little when you asked me this, because I know it had to be 10 years ago, and I was teaching a class, and had still been working in economic development. I was thinking about what is a real good working definition, and so this has come back full circle, I suppose. Really, community economic development is it's a comprehensive market-based strategy to fighting poverty. I guess if I brought out two sort of quick things that I think are the key areas of community economic development is one, that it is community-based, hence community. With the theory and belief that community residents should have a voice and be able to make decisions about what happens in their community, so that they are the best voice, they are the best people to make those decisions. And then I think the second part is that it is economic development, sort of as opposed to or in conjunction with social development. So it is not exclusively social, but that we believe that, it is this economic system and these economic sort of barriers that really affect some of the social. And so we sort of lead with the economic development as opposed to the social development. I mean, the healthcare industry is now talking about how housing affects sort of health outcomes, and they call those social determinants of health. And they are focused on sort of these health outcomes, and community economic development would be focused on the built environment a little bit that affects those social health outcomes. So community-based and lead with economics.
Well, that's super helpful, and thank you for that. And, at the top, we kind of talked about your work through the initiative and that it led to 7,000 units of affordable housing, nearly $500 million of private capital investment. You've been doing this work for close to 20 years. What's your sense of it? Is it impactful? Is it a good strategy for creating opportunity in persistently poor and marginalized communities?
I think that it has been effective, and it's a good strategy. But it does have its limitations. I mean, I think it has been effective because it's but for community economic development. There are some things that we wouldn't see. We wouldn't see some affordable housing in, for example, Rocky Mount in North Carolina, or we wouldn't have a five-star daycare in Camden County, which is in eastern North Carolina, or we wouldn't have a senior center serving poor community in Wilson. So there are certainly these things that we can look at and say, but for community economic development, that these things wouldn't be there. And so in that regard, it is certainly impactful, and I think a good strategy. I do think, though, that it has, for different reasons, been limited. I mean, I sound important saying 7,000 affordable housing units, right? But we need so many more than 7,000 affordable housing units in North Carolina and throughout the nation. I mean, the entire nation is in a affordable housing crisis. And that is, we were in that before COVID, right?
Right.
And so I think that while it has been impactful, I think that we have the infrastructure in that I do think that people need to be able to have some say so in how their communities are built. Um, and the key is to be able to scale the work so that it is even more impactful. So yes, it has been impactful, and yes, it has been, I think, a right approach, but it also can be more impactful with the right kind of investment and the right kind of adjustments.
You know, the examples you gave really are super powerful, right? A five-star childcare center in a relatively rural part of Eastern North Carolina is transformative for that community. Um, you know, at the same time, we're in this bigger discussion about structural racism,
Right.
structural inequality, which is both, at least in my lifetime and my sense of things, very unique and may really create opportunities for us to create change in ways that we haven't seen.
Yeah.
But it is also kind of structural and at a macro level, which is different than the kind of community-based economic development work that you've been talking about. You know, how do you balance those sorts of things, and what do you think are the particular opportunities right now to look at structures and how structures relate to building a more just and equitable society?
I think community economic development has been a response to the structures that are in place. Ideally, we are able to either eliminate or dismantle the structures that lead to poverty, right? That, ideally we get rid of. You even described this. Community economic development is generally about some geographic, some community. You know, ideally and those are created by structures. Those are created by economic structures and policies and those things. So ideally, we either dismantle those structures or we eliminate those structures and rebuild ones that are more equitable, right? So what makes this time really exciting is because we're talking about how do we get to the problem as opposed to the symptom.
Mm.
Community economic development, a lot, unfortunately, treats the symptom. And when we talk about structural racism and systems and structures, then we're going to the problem. So we have an excellent opportunity to figure out and to build and to rebuild in a way that we don't even have those geographic areas, that we don't even have to deal with the symptoms, or at least we have to deal minimally. And that we can really deal with the problem, which is the structure. I mean, so we have talked a little bit about housing, and there are clear structures in place. There have been laws that have been put in place and practices that have been put in place that create basically our lack of affordable housing, and certainly with in communities of color. I mean, those are things that are done, and so we can deal with that at the beginning. Then we don't have to deal with as many symptoms. So it's really exciting. I think the key is going to be, getting the right kind of leadership, and then building off sort of this consciousness, social consciousness that people have to really educate people about the structures. And then the hard part, of course, is then to act and be willing to move in a way that we dismantle those structures and rebuild new ones, not just dismantle, but rebuild new and equitable.
Well, I think that framing is really helpful, thinking about so many of the interventions that we've tried over the last several years or decades being focused on the symptoms rather than the cause, and really now having this chance to get to the cause. This is a short discussion and this is a big question, but if we're successful in that work, what do you see? What does health look like? What do you see as the essential characteristics of an equitable society?
Yeah, this is a big one. I think that the equity looks like has maybe a couple characteristics. How you get there is a lot of work, but equity, I think, looks like when a person is born, a person's, where they are born geographically, their zip code doesn't determine their health outcomes, their education outcomes, what age they are when they die, if they have hypertension, right? Like that, where they are born does not determine those other things their entire lives. You know, if they are in prison by a certain age, if they can read. And so I think that's what equity looks like, right? Equity doesn't mean that everybody will be the exact same, but what equity does mean is that everybody will have access. Everybody will be able to make real decisions and have equitable access to education and health care and childcare and jobs and all of these things that that are just sort of staples of society. So equity, I think, means that people have access to that, and it's not predetermined for them.
So, I mean, as you said, getting there is a lot of work.
Mhm.
And you've already been doing a lot of hard work for a long time. You could be doing a lot of things. What calls you to do this hard work, and how do you sustain yourself in it?
It is a calling. I mean, you know, I ultimately believe that change is possible, that there is something in us, you know, in our humanity that really, at least the majority of our humanity, that really does want sort of justice and equity. And so, so I just believe that we can do it. Change is possible, and that's sort of what drives me. That, and this is where I'm called to spend my time and my talent in trying to make things better. You know, I really believe that we have, you know, we have an obligation to speak out for those who can't speak out for themselves. We have an obligation to, you know, just sort of push this envelope, push the line, so that more people can just live and just live, you know, just basically live without having so much pressure. And it's based on something that they didn't have anything to do with. So that they can live without the pressure of a system that they didn't have anything to do with, that they were just born into. And so I just think I think it first is a calling, and I think it's sort of my belief in that humanity can change. And what keeps me going is, you know, just this, you know, just like-minded people, um, you know, sitting on the back porch and having this conversation with you, even in the midst of COVID, which creates so many more challenges, and to know that real people do want to have change and are working really, really hard at it every day. And so if other people are working really, really hard at it, then I feel like I can too.
All right. Well, I think that's a good place to end it. So thank you for all of your hard work, and thank you for sharing your insights and your thoughts today. We really appreciate it.
Thank you, Andrew. I appreciate it.